We're going to have a conversation this morning regarding men's health, and it may be a topic that some people are not perhaps very comfortable with, but I think by the time we're through talking, you'll understand the benefits behind the procedure we're discussing today. Ed Jones is here from Nutrition World. With him, Dr. Kerry Friesen from the Friesen Center, and the two of you, welcome, are collaborating with something called EDWave. And we're going to talk a little bit about how it's used and the benefits you're already finding from it. So good to have you both.
Thank you. Thank you.
This is brand new to Chattanooga, Ed, like 2 months into it, right?
Exactly. And, you know, my history of being involved with health and nutrition, I've been on here for 15 years probably. So many men, especially past age 40, are having issues with erectile dysfunction. Part of it comes with the lifestyle that we're living, the stress we're under. You could fill a page, and certainly Dr. Friesen can go into this. But a couple people I knew came across the this new type of technology that's found in Europe that was about 80% effective, and it's completely painless, and it only it has to be done 6 treatments 1 time a week for 6 weeks. And it is incredible what's going on with the success stories that's coming out of these people.
Okay, let's talk a little bit about what the it is. I did a story actually here on Channel 3, Dr. Friesen, about 8 years ago or so, when it was happening in Europe. It was sort of the first place this was utilized. As I understand it, it's an energy wave, and it's the same thing in theory as what they use for kidney stones.
Yeah, exactly. It's low intensity, though. Low intensity rather than the shock wave. It's low intensity sound waves. So it's really, we call it vibroacoustic sound therapy. Okay. So we're literally using sound at a specific frequency that triggers micro trauma within the target. And that micro trauma stimulates a cascade of things that involve creating new blood vessels. We call it angiogenesis. Okay? So it's the making of new blood vessels, and it's the microtrauma from the sound waves. So there are no pills, there are no potions, there are no injections, there are no IVs, there are no dyes, there's nothing. It's very, very simple. Actually, I had a treatment before I walked up here today. Yeah. Really? Yeah, just half an hour ago.
So we mentioned the 6 treatments. Men are going once a week for 6 weeks. You see pretty marked results after 4?
Usually after 4 treatments. Clinically, they start to see a benefit. Depending on their very specific problem, some people require another treatment, or 2, it's happened. But generally speaking, 4 treatments, they start to see the clinical benefit of it. And the beautiful part of it is because this is such a physiologic treatment, it's improving blood flow. So it doesn't go away once you stop the treatments. You actually continue to improve blood flow.
Right.
And for men, this is very much a use it or lose it organ, okay? Because if it's not being used, then there's no demand on your body to improve blood flow or for it to even change at all.
I would imagine you're also seeing marriages improved here. There are issues and parts of your life that this particular topic addresses more than just a man's self-opinion.
I would argue that that's the bigger part of it. The bigger part of it, because we make relationships work, because people find them. For men, there's this silent plight. They don't know what's happening to them. They can't understand why things are not working the way they're supposed to. And for men, their identities are pretty much tied up in that. It's crippling from a relationship standpoint.
Ed, you had mentioned that probably 10 years ago, this is a conversation that we would not have been able to have on television, as well as perhaps in public in private conversation. Yet at Nutrition World, for years, you've seen this change where men would maybe send their wives into the store to ask you some questions, and now they're open to talk about it.
Far more open than ever, but because we have kind of, I think, have trust in the community, and people share a ton with me about their personal life, I get probably 5 to 8 men a day that are coming in asking because there's issues involving them. And there are some natural remedies that can be helpful, one of which is beet capsules. I love beet capsules because it raises nitric oxide. And on our website, Nutrition W, I've got a great article on how all that works. But this is the fix.
Okay, speaking of websites, you can go to theirs, which is EDWave.com, and there you'll see Dr. Friesen's information. You can read a lot more about this procedure, or really it's just a way of addressing it, not really even a procedure. That implies a medical intervention, and that's not really what this is.
It's a procedure, but it's such a minimally invasive procedure that the end result is I mean, I had the treatment just half an hour ago. It's like nothing, just walking around, just enjoying life. So.
Talk about the cost factor involved, because if you are taking medication to address this, that becomes, I guess, essentially lifelong, right?
Yeah, exactly. So the majority of fixes that are out there are not fixes at all. They're pretty much a Band-Aid. So the end result is, and I've done the math because treating men for years, I can prescribe a pill, and the pill may be effective, but it can be $200-300 a month, and that's ongoing and never ending. And it's still just a Band-Aid. It's not really a proper physiologic treatment. So if you eliminate the expense of all those other things, you more than pay for the treatment with a year's worth of Cialis or Viagra.
I know at your office, and same with Ed at the store, you're addressing kind of a holistic approach to a person's life. So if this is not addressed, and especially kind of early in to experiencing some symptoms, and what is it, like 50% of men or more?
50% over the age of 40. 50% of the men over the age of 40,
It does then affect the psychology, right? Which then leads to depression and withdrawal from life.
And for most men, they're not willing to talk about it. And so their significant other, their spouse may not even know. They may be aware of the problem, but they may not be aware of psychologically the trauma that's going on day in and day out. So it's a big deal. It's far more than just sexual health. It's more like intimacy and relationship.
And Ed, you told me a story of some women that you even know of who've put the blame, so to speak, on them, and they've felt now bad about themselves.
Absolutely. I mean, any counselor who counsels on this sees that, and it's such a, like Dr. Friesen is saying, that sometimes the communication is not occurring between the partners, and one is thinking something, then there's no mind reading between people, and it just cascades into this devastating place that many times ends in disaster.
Do you ever see couples come in to counsel first before they begin the procedure? Yeah,
we do that. It's actually, if you see our Cityscope ad, HealthScope ad, it's actually called our Couples Relationship Rejuvenation Program. Okay, so because we offer a similar procedure for women called FemTouch, and that procedure is vaginal rejuvenation, and this procedure for men addresses the problems with erectile dysfunction. So we're literally in the business of bringing couples and families and relationships back together because they both have a way to improve their general health and build on the intimacy that brings.
I guess the takeaway would be that this is not a conversation that many of us still are very comfortable having, and yet there's research being done, and now doctors and nutritionists stepping in to maybe help answer some questions before you even have to ask them. So EDWave.com is their website. At the Friesen Center, you'll find Dr. Kerry Friesen on Lee Highway. Of course, you know where to find Ed at Nutrition World. Thank you both so much.
Thank you, Julie.
Thank you.
We're back after this.